UBC, inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Each year, hundreds and thousands of women lose their lives to cervical cancer. Yet many do not know that this disease is highly preventable with measures such as screening or vaccination. With me in the studio are Doctors Mugisha Moses and Dr. Musinguzi Daisy to help us understand this big monster that seems to be killing many Ugandan women, this monster called cervical cancer. You're most welcome, doctors, to the show.
Thank you.
And you are watching the DOCtalk show. I'm your host, Dr. Darius Owach. So let's get down to business to understanding what cervical cancer is and how it can be prevented. So, Dr. Daisy, you in your field, you interact a lot. By virtue of your specialty, you deal with women's health. And cervical cancer, when people talk of cervical cancer, it rings so many bells because it causes so many deaths, causes so much misery in families. Help us understand what exactly cervical cancer is in the first place before we can dive into how to prevent it and all.
Yeah, the cervix is an entry and an exit into the uterus. Entry in reproduction, as in fertilization and the likes, and then exit during labor and delivery.
Okay. So
it is.
The cervix is part of the uterus.
Yes, it's
of the
part of the
woman's
uterus.
womb.
Yes.
It's the mouth or
The
what you say,
entry
the entry
and exit of the uterus.
of the uterus.
Yes.
So then, what is a cancer?
Cancer
Yes.
is like an abnormal division of cells. Okay. Normally, cells, yes, they undergo a life cycle. At the end of this life cycle, they're supposed to die. So now, cancer cells do not die; they continue to grow and become and are abnormal for that reason.
Okay.
And so
you're saying cancer cells or cancer per se is an abnormal growth of tissue.
Yes.
Okay, of some parts of the body. They're not. They grow beyond the size they're supposed to be.
Yes, they grow beyond what they should be.
What they should be.
Yes.
And in this case, cervical cancer is an abnormal growth within the cervix.
Yes, of the cells that line the cervix.
Of the cells that line the cervix. Right. It seems to be a very common disorder affecting so many women in Uganda, but fortunately our obstetricians in the studio are the best place to help understand more about this condition. So Dr. Mugisha, how common is cervical cancer?
Cervical cancer.
Oh yes, cervical cancer.
You alluded to it being a monster. I wouldn't really want to call it.
We think it's a monster because apparently many people die of this condition. So it seems it may get its credit for its name.
For that, I'll get to why I think it is a more friendly, a bit of cancer we can really foresee and prevent.
Okay.
So it used to be a very, very prevalent cancer worldwide. And we tend to see that in developed countries, it has really taken an upside turn. It is no longer as prevalent as it used to be in the 1960s, way earlier. And it used to be the most common, and it's now almost the 5th or 6th commonest cancer in the developed countries. So we're asking ourselves in the developing countries, sub-Saharan Africa, what is the problem? In Uganda currently, yes, it is the most leading cause of deaths, cancer deaths in our reproductive cancers in our women, and we are seeing what did these people do that we actually did not pick up with them and follow suit. The World Health Organization in 2016 says that we diagnosed close to 4,000 women, Ugandan women, with cervical cancer, and yet nearly half of these die within that very year. So you see it is so lethal. The reason for that is really because we see it so late in the stages and cannot do so much. But prevalence-wise, we think prevalence-wise, we think the actual infective cause, as we shall later allude to, a virus called human papillomavirus, is very prevalent in our population.
Okay.
It's an infection, and we know this has been found and tested to be a causal factor for this cancer. And 1 in every 3 girls have actually do have this HPV infection actively. So
Okay.
it is an infection we get, and cumulatively, in a lifetime of a lady, about 80% of women will actually get this infection. Of course, we are not putting the guns to the women; they are definitely getting it from the men. So it is just equally as prevalent in men as is in women.
Okay, so we'll slow down there. You said about 4,000 women were diagnosed with cervical cancer at some time, and within the same year we lost half of them. That is almost cause to worry. That's why we call it such a big monster. And you suggest that because we pick it late, that we get it when it's in its advanced stages. That's why we end up losing so many of our patients. So maybe in this show we shall now understand how best to catch it early and to treat and prevent it. Yes. So let's talk about this cause which you said, the human papilloma virus, the HPV.
I think
Dr.
that
Daisy,
is.
what
I
exactly
think,
is that?
I think that's why he insists it is not the worst cancer. Okay? Because you see, with human papilloma virus, HPV, if you find it early, it can be treated. Okay, but most times these women, the reason why a large percentage of the women diagnosed in 2014, the 4,000, the reason why most of them died was because by the time they came, they were in an advanced stage of cancer.
Okay.
But generally speaking, if we find these women, if we set up a protocol to screen young women early enough, we can reduce the mortality.
By screening for the virus, you treat it.
Yes,
Then
the
you
earlier
can
you
prevent?
screen, the earlier, yes, you treat and prevent progression of disease.
So, so we have emphasized the point of prevention by screening. But how exactly is this virus caught anyway? Is it some kind of, is it like a cholera when you eat bad food and then you get this virus? How is it transmitted?
HPV is a sexually transmitted virus. Okay.
Okay, just
So,
like these other, maybe syphilis or HIV.
yes,
So it's
yes,
transmitted the same way.
similar mode of transmission.
Okay.
Okay, so what happens is this virus will invade the cells of the cervix and start to multiply there and cause changes on the lining of the cervix. And then, so what happens is when these women come and we screen, if you have gotten the infection, we can manage just that infection. But most of them tend to delay to seek help because it doesn't come with symptoms. Like, it's not like the syphilis and gonorrhea where you come and there's a discharge or pain. Okay, this infection comes and you don't even know that you have it. That's why it's necessary to.
So that's why it's important to screen for it.
Yes.
So, very common is it only in women? Is it only women who get this infection?
If it's sexually transmitted, Darius, definitely they are
That
getting
means-
it from somewhere.
So it can
it
also
is
affect
carried
the
by
men.
both men and women. It's just that cervical cancer is caused by it in women.
And maybe that's why the bias of the discussion tends to focus on women. But we must remember that this infection, being sexually transmitted, can also be acquired by men. And the particular strains that cause the cervical cancer in women can cause cancers in men, more particularly cancers of the throat or of the genitals, of the penile or of the rectum. Okay, so remember you're watching the DOCtalk show. You can always send your comments, feedback, questions to the social media platforms on Facebook and Twitter. We are discussing cervical cancer. Please don't go away. After the break, we're going to understand how one can tell that they have cervical cancer and what can be done to treat and prevent this condition.
You are watching the DOCtalk Show. You are watching the DOCtalk Show.
So welcome back. We are discussing a type of cancer that affects so many Ugandan women. Unfortunately, causes so many deaths in the Ugandan women population, yet is a very preventable disease, that is cervical cancer. We are going to understand how one can identify or tell whether they could be having cervical cancer by virtue of the signs or symptoms, and how best one can prevent themselves from getting this type of cancer. So, Dr. Mugisha, when someone acquires this infection, what exactly happens? Is it like immediately guaranteed they are going to get this cervical cancer?
So thank you.
What could you help us understand? Is it true that everyone who gets this virus will get cervical cancer?
So it is a very gentle and its onset is over a very long protracted period of time. It is projected that from the time you actually acquire this virus from, say, contact with somebody with, it probably lasts about 8 to 10 years for you to start seeing changes and actually develop a cancer. So we do feel that it gives us ample time within which we can actually screen and look for these cervical changes. Dr. Musinguzi alluded to when you get the virus, many women clear it. Cumulatively, I told you over 80% of girls and women do actually acquire this HPV. As long as they are sexually active, it is hard. They will actually acquire it. Majority of whom clear. Majority of whom will get it and clear, like many other illness. But there is that portion that it remains persistent. If your immune system is low, you probably have other chronic diseases, maybe diabetes, HIV, sepsis, you're on certain drugs which reduce your immune system, you're malnourished for some reasons. Then this virus flourishes because now you're not fighting it. So it is that persistent, the persistent infection that you actually have that later predisposes you to cervical changes.
So it isn't true that every woman who gets this infection will get cervical cancer.
No.
It's just the women in whom the infection persists.
Yes.
Okay, and you suggest that the reasons are related to the immune system.
Yeah.
When we talk about immune system, these are like your body's defense against infections. So if for some reason the body's defense is not able to clear this infection, in this case HPV, if it persists, it will result into the cancer. But you mentioned that time period. What did you mean by that time period?
Yeah, the time period of about 8 to 10 years. It's very generous. So we don't usually see this cancer in 20-year-olds. We think you've started being sexually active maybe 10 years. So you see, it gives us a lot of time for changes to actually develop and you have cancer. So there are changes that happen that are not necessarily cancerous, but they are leading to. And when we talk of screening, we hope we can pick some of those cervical changes. So cells there start to change, blood supply changes, appearance of these cells changes. And when you do frequent screening, we can actually pick these changes and say, you probably headed there, but we can actually stop this cancer at this stage before we actually head there.
Okay, so we'll talk a bit more about the screening. So, in other words, just saying, much as it's a very common infection, few women will progress to develop the cancer. Even if they progress, it will take about 10 years or so before the cancer becomes established.
Yeah.
So you're emphasizing the importance of screening early.
Yes.
In that age, is that why they recommend screening in young women, Dr. Days?
They recommend we screen women from the age of 21.
By 21.
Yes.
Okay.
Regardless of their sexual debut.
Okay.
So every 3 years from the age of 21, we recommend women to be screened for this HPV.
For HPV and cervical cancer. Yeah. Are there some signs and symptoms one can that one can tell that they have cervical cancer?
Early stages of cancer of the cervix is asymptomatic. So most women will not present until much later. We said 80% of the women who we see currently with issues of cervical cancer come when it's too late.
When it's in a late stage?
Yes.
So the early stages of this cancer,
they are symptomatic.
They have no problems? They are
symptomatic. Not that they don't have problems. They might have some problems like maybe pain or irregular bleeding, but it won't be enough for, unfortunately, for them to seek medical help. They might think it is not a big issue.
Okay. So but the symptoms are not so common in the early stage of the disease.
No, they're not.
They become more predominant in the late stages.
Yes.
So which are some of these symptoms? Which
they
one should be aware of?
They vary. Most of the most common one I have seen is they present with bleeding. Okay, either while they wash themselves or after sex, they tend to bleed. It's called contact bleeding, and it's one of the most common things that we have seen. There's also pain during sex. Okay. There's a discharge. Sometimes these women come with a very foul-smelling discharge. You can tell from.
It is not the discharge of, there are these sexually transmitted diseases like syphilis or gonorrhea.
I would like to.
Discharges.
Okay, I don't think
that. Is it almost similar?
No.
It's a pungent smell.
Yes, you would know.
It's a repellent.
Yeah, and it's strong.
A very strong discharge.
And it's not like, you see, with the STDs, it's normally very little. Okay. With this one, it's sort of like water.
It's a big amount of discharge.
Yes, a large amount of discharge.
So bleeding, you mentioned contact bleeding.
Yes.
Pain during intercourse, and this discharge.
Yes.
Are these the only signs that are available?
No, there are many, but again, like we said, it depends on the severity. There can be also infertility. Okay. There can be issues with the kidneys. In later stages of cancer of the cervix, there can be swelling, strokes. Okay. It depends on.
So, Dr. Mugisha, help us understand how does cervical cancer cause kidney problems?
How does it affect the kidneys?
Yeah, it's located in, these are two different organ systems, but it's surprising that a cancer in the cervix would cause kidney failure. How on earth does that happen?
So the uniqueness with description of a cancer is like it metastasizes, it grows way beyond the confinement we actually want it to be. And that's the symptoms, as she's alluding to, later set in because of that. So it starts on the cervix, and we hope we can pick it up as early as possible while it is still on the cervix. A little later, it tends to grow all the way and fill the space in the pelvic, because the pelvic area is a small confinement. Any additional masses affects anything in there. So, two ways the kidneys might be affected. One, those masses could get to compress on the bladder and the tubes that bring urine from the kidneys to the bladder for you to urinate. So in the long run, that mass effect allows urine to compile up, and not the urine comes from the kidneys. So you don't void per se, but it piles up and sort of suffocates the kidneys.
And blocks the kidneys. Okay.
The other way is they metastasize. They move. The cells will move in blood and attack every other body part that you have in later, very advanced stages of this illness.
Okay. So they can also cause injury to the kidneys themselves. Exactly. And the cells make their way up to the kidney. Send in your questions and feedback to our social media platforms, and stay tuned.
You are watching the DOCtalk Show.
Join us on Sunday, January 26, 2025, as Uganda celebrates the 39th anniversary of NRM Liberation Day. This momentous occasion marks the day when the National Resistance Army or Movement, NRMA, took over power, led by President Yoweri Kaguta Museveni. The celebrations will take place in Mubende District at Mubende Teachers College grounds under the theme 39 years of NRMA, salutations for those who re-sanctified our homeland. Don't miss the live broadcast on UBC TV as we honor the sacrifices and achievements of the NRMA. A day to reflect on Uganda's journey towards peace, stability and prosperity. Tune in on January 26, 2025 and be part of this historic celebration.
You are watching the DOCtalk Show.
Welcome back. You're watching the DOCtalk Show, and we're discussing one of the cancers that's most common in women. Unfortunately, causes a lot of deaths in women. This is cervical cancer. Much as it's a very prevalent or very common cancer in women, it is highly preventable if we institute measures to detect it early enough and treat it. With me in the studios are experts in the field, Dr. Musinguzi and Dr. Mugisha, to help us understand what treatment options are available to treat this condition called cervical cancer, and if there are ways we can prevent it in the long run, prevent people from getting prevent women from getting cervical cancer. Okay, are there any other apart from the kidney, anything else you should worry about in cervical cancer?
Yeah, like any other advanced cancer, whether cancer of the lungs, cancer of the pancreas, gut, once it starts moving in blood, you could talk about complications of any magnitude, whatever length. If we had to start with just the local invasion of structures within the reproductive areas, it will even stop blood flow from the lower limbs, the legs. So blood and some fluids that ideally would drain cannot go up or to the heart to be pumped, and also you see your legs swelling over time, which we call edema, swelling. Sometimes you can't move. They affect the nerves. You get numb. If it goes into the brain and the spinal cord, you will have all those sequelae. You will have strokes,
like
as
paralysis and strokes.
Yeah, might have strokes, numbness of various degrees, depending on where that is really affected.
Okay, so all these problems we're talking about, they mainly occur in the late stage, in the advanced stage. So it means if someone is able to pick this cancer and treat it early enough, they can avoid this.
Actually,
problems.
I think altogether in the screening process, you can prevent it from becoming cancer. Okay? So like if you get it early enough and you treat the virus, the local invasion of the HPV at the cervix, you can prevent it from becoming cancer. That's why we think that it is a more lenient version of cancer. If we can get it early, you don't have to progress
before
to
it actually becomes an established cancer.
You don't have to get to cancer.
So how exactly can we screen and prevent this cancer? By catching it before it progresses any further.
In our Ugandan system, we have about four prevention methods we can use or that are at our disposal as health professionals. The first, and which we think is at the lowest levels of healthcare in Health Center 3, Health Center 4, is just visual inspection. And if we see any abnormalities, we know what it should look like. Any color changes that we do not expect are suspicious at the very least, and therefore necessitate us to go to the further screening techniques.
So that first test you said is called visual
inspection. Yes.
Inspection.
Visually look at the cervix.
Okay.
That is all.
Okay. And it's available at all the health centers.
Yeah.
It should be available.
Okay. So if are there any other ways we can detect this cervical cancer before it goes out of hand?
The one that has really been the cornerstone of prevention of cancer cervix worldwide, and also that the government is trying to intervene in and make quite available, is what we call the pap smear.
The pap smear.
Pap smear.
What is the pap? I will help people understand what this pap smear is.
Pap smear.
Yes.
Basically, in simple terms, we just need a few cells. We brush off a few cells of the cervix, off the mouth of that uterus, just a few cells, and look at them under a microscope. So with that aid, we can actually tell that these cells are beginning to become stubborn. They are not yet cancerous. Yes, if they are, we can still see. But as long as we see a little difference, a little deviation from the normal appearance of these cells, we then act accordingly. So pap smear, by and large, is what is most credited for the turnaround worldwide of
preventing
prevention of
cervical cancer.
Yes.
Dr. Daisy, is this pap smear test available in the hospitals? Which hospitals have this test?
Pap smears are done, I think, in all regional referrals should be able to do these pap smears.
Okay.
It's basically just an office procedure. The patient comes in, you do a swab, or using a brush, the specific
specific type of brush.
Yes,
and it's
apparatus.
It's done under the supervision of a gynecologist.
It must be done by a gynecologist.
Must be done under a gynecologist.
Yes.
Okay.
Because you're collecting cells from the upper part of the vagina and the cervix.
Okay.
Okay. So you need to know what goes where.
Okay. So if you say the key message is to prevent cervical cancer, some tests can be done, which include the pap smear, but should be done under the supervision of a gynecologist.
Yes.
To make sure it's done right, so that you can actually diagnose the
Yes.
problem.
You see, the problem with that, however, is there are not so many specialists, gynecologists, as you want to put in. So then you restrict the diversity or the availability of some of these services, especially in very low resource settings. So being stringent on a gyne might not really hold so much water, and we think really a health personnel, well trained, can be able to just make a brush or scraping of those cells and send to the lab for cytology.
Okay. So remember, you're watching the DOCtalk show. We are discussing cervical cancer and how we can detect it early. Our experts in the studio have told us some tests can be done at the hospitals. One includes a visual inspection of the cervix to see if there are any abnormal changes in the lining of the cervix when we use a liquid called acetic acid. The second is probably a more sensitive test called the pap smear, where a special brush is inserted into the cervix. It scrapes off some cells and it's studied under a microscope. And there the doctor can tell if indeed the cells are normal or they becoming abnormal towards the stage of cancer. So Dr. Daisy, how is this condition treated, this cervical cancer?
Before we talk about treatment, we were earlier discussing screening, okay? And I think we hadn't fully exhausted I think about 2 other screening methods that are used today. Okay. One is HPV testing. Okay, we test women above 30 for HPV and
for the virus.
Yes, for the virus itself. It's more sensitive, but it's also quite costly. But those are some of the current screening methods. Another one is using colposcopy. Colposcopy is basically getting a camera that magnifies the cervix. Okay, you focus it on the cervix and it magnifies, and you can easily identify if there are any anomalies on the cervix. On the cervix.
So yes. That is in addition to the pap smear and the
yes.
VIA, the visual inspection.
Yes, visual inspection is more like, it's not as sensitive.
Okay, it's not accurate.
Yes. So normally when these VIAs are done in the health centers, for example, and these women are identified as having some sort of abnormality, they are sent to, for example, Mulago for further testing, where you'll do the pap smear or you'll do the colposcopy. And
so VIA is like the starting point, then we can use the pap smear.
It's the least sensitive.
Then the other more sensitive tests. But yes. Are they available in the country, these tests you talk about?
Yes, they should be available in the big hospitals.
Okay. So at the very least, you recommend at least every woman should have a pap smear?
At least a pap smear if you're above 21.
And how often should they do this?
It should be done every 3 years. However, if you do a pap smear as well as HPV, yes. Then you can take 5-year intervals if they are both negative.
Okay. So periodic monitoring of these tests with the pap smear or with the additional more sensitive tests, at least 3 to 5 years is recommended for every woman of reproductive age in order to detect cervical cancer so that we can treat it early enough.
You are watching the DOCtalk Show. You are watching the DOCtalk Show.
So, Dr. Mugisha, now coming to cervical cancer treatment specifically, what treatments are available? Is this disease, it causes lots of deaths, but can it be treated anyway?
As we go to treatment, we cannot reiterate enough that screening and prevention is the cornerstone for this management. We have to prevent you from actually acquiring this cancer, if we can, as much as possible, yes.
They said that prevention, is it treatment? Prevention is
better
than cure.
Yes.
Yes. So
and this is just the actual definition of do not get it. If you get it, we really have a very small window within which to play with management options. So they are not as encouraging. And as we've said, majority of our clients come in very late in the disease. And that is over 80. So it is a very silent illness. People don't get to know. And many of our wives and girls, they really don't, they're not so proactive with the screening. Majority of girls have actually not had the screening done. So until the symptoms come way later into their reproductive years or even way beyond, do we get to, oh, now it has come, and so what do we get to do? So if it is very early in the stages, maybe stage 1 and maybe a little bit of stage 2, surgery can help. And in this case, we try and remove the whole uterus and the whole cervix, the whole of it, cervix, uterus, and maybe many other organs around the womb and the cervix. Trying to make sure that we are thorough with the removal of all the cells. But that is also too early within the stage. But like we said, many come way beyond with other treatments, especially at Cancer Institute. They've made use of chemotherapy, use drugs, radiotherapy to try and shrink the mass and relieve symptoms. And also mix, do surgery, do some chemotherapy, radiotherapy, but none of these also really gives us very good outcomes. These are just to buy us time. Like, we are trying to prolong the lives of these people, the lives of the culprits around. So they are not curative in any way, and we are saying, try to prevent us from getting here if we can. Yeah. So, and the managements are palliative, really. We try. Are you in pain? Do you get bed sores? Many tend not to move. Can you urinate? How do you pass stool when the blockage is blocked? Majority of things are just palliative in nature.
So what you're trying to bring out is the early stages with surgery you can cure the condition.
Yeah.
In the early stages.
Yeah, exactly.
But the problem comes in the late stages, where the majority of the patients you see, I don't know if this is only in Uganda or worldwide, when they present in the late stage, the treatment options are very limited. Surgery doesn't work as well, radiotherapy, no. The use of drugs may not work. So it's basically reducing the impact of the disease, but without really a clear treatment.
If it's advanced, what they try to do is just improve your quality of life.
Okay.
But it is not curative in any way.
It's not curative. So the key message is we should attempt to catch this disease early enough, and before it becomes too advanced.
Before it comes.
And you told us ways in which one can detect this disease early. That is the screening methods using the pap smear. We emphasize all women above 21 years should have a pap smear done every 3 years, in addition to other screening tests too. Check if there might be abnormal cells that can be treated early enough to prevent this condition called cervical cancer. Is there any other method that can prevent cervical cancer?
Currently, there's vaccination of young girls against HPV. It starts at around the age of 9 to 13 in Uganda, up to the age of 19. Worldwide, it's up to the age of 26. So what happens is you give these girls 2 to 3 vaccines, and what it's supposed to do is to prevent them from actually getting this infection. Okay. It gives you a life protection. like you're protected over.
Lifelong protection.
Yes, lifelong protection.
And it's available to young girls.
Yes.
Why is it in such a young age, 9 to
You want to read.
19?
You want to.
Why do they say that this age group?
You want to capture them before they get exposed.
Before the exposure to that.
Because we are assuming that between the ages of 9 and 13, you're not sexually active. Okay. So you want to catch them before they become exposed later in life.
So the goal of vaccination is, before the person is exposed to a disease, you give a vaccine
to prevent them from.
So the way vaccines work is they help build they build the body's immune system so that in the event that the actual infection occurs, the body can quickly eradicate it. So I wonder, so Dr. Mugisha, if this vaccine is only available to young girls, what about those who are beyond the age of 19? Will the vaccine still work for them, for the women who are maybe 30 years, 40 years?
Maybe just to correct, we are not saying it's just for girls. Even boys ideally should be vaccinated because they are the transmitters of actually, they're the vector, they move with the virus and give it. So they should, but various bodies sat and said, if we are going to curb it, let us try and focus on the lady who actually suffers from this, from the cervical cancer illnesses. Not that it doesn't have an effect on the men, but penile cancer is really, really rare. We don't usually see those other symptomatic presentations in men. So the focus has been on the women, and we prefer before the exposure. So it should be before you actually acquire the virus. That's when it is important. That's when it is beneficial. It is productive. If a young girl has been sexually exposed at 16, 17 years, giving her the virus is not protective in any way.
You mean giving the vaccine?
Yeah, giving the vaccine. So it is prudent that you tell them this is supposed to prevent, but if you have acquired this in any prior interactions, it is not going to be so much helpful. So here and about, you will see many women or girls, 30 years, 32 years, who will walk up to you. Why can't I get this vaccination, now? So the 26 is an arbitrary age that was, it's a worldwide age. We believe by 26, majority of the women have really been exposed. And it should even be given, maybe if you've had one sexual partner, you've been so faithful, and we are saying you have not had that, you have not acquired it, so maybe either you've had, that one sexual partner for quite some time, or you've been celibate for over a prolonged period. That's when vaccination in later ages might make a little bit of sense, but it is usually a misuse of the drug if someone has already had sexual partner.
So the problem will come in if it's a lady above the age of 20, 21. You won't be able to tell whether she has been exposed to the virus or not.
It is hard to tell.
It's hard to tell. Yeah. That's why you would restrict the vaccination to the younger group, where at least you're almost certain they've not yet commenced a sexual debut, so most likely they won't be infected with the virus.
Exactly.
Okay. So just remember the vaccines are available on the National Immunization Schedule. These vaccines are available to all young girls aged 9 to 19 years of age. So if you are a caretaker of a young girl who is in this age group, probably school going, and she has not yet been vaccinated against cervical cancer, please take her to the nearest hospital and she receives this vaccine. It's completely free of charge, and it's, as we know, prevention is one of the most effective ways of preventing disease. So if you can prevent yourself from getting the virus, you prevent yourself from getting the cervical cancer. I think that should be the main point which people should understand. And also, on top of vaccination, we encourage women, all women above the age of 21, go for periodic checks for cervical cancer. Our experts have explained there are different methods available: the pap smear, the tests for the virus itself, or colposcopy. All these tests are available in the hospitals. Please go and get yourself checked at periodic intervals. Every 3 years is recommended in order to catch this disease and treat it as early as possible. Thank you for watching the DOCtalk show. We thank our guests, Dr. Mugisha and Dr. Musinguzi, for demystifying this huge disease called cervical cancer. And we hope the message has reached home, has reached your heart, and that you will take the message very seriously and prevent cancer. Thank you for watching and have a great evening.
This week on UBC.
My name is Lieutenant Colonel Peter Demuka. What we are doing currently using these two machines, one here and one at the other end, is we call it sowing. We are trying to plant in a artificial grass to make sure that we produce a hybrid pitch, which pitch will be resistant to the traffic, because various matches will be played consecutively, so we don't want it to be damaged. So the government has invested in more money to make sure they strengthen the turf by making it hybrid. And this is, I think, maybe the second or the third pitch in Africa to have hybrid, according to the specialists from CAF. So really, we are working hard to ensure that we are ready. What was remaining here basically was the floodlights. The original floodlights have been put. The testing has been done, setting has been done, so we are good to go. Even externally, we have put the floodlights, so there is nothing pending. So we are ready to go. Even as you see around, we have put what we call the escape routes. In case of fire, people can come inside and then they go to the pitch. This is the training pitch. This training pitch here, basically what we are doing is winding up the works which were remaining. We had to fix the floodlights which are up here. There are over 36 lamps fixed and they are all functioning. Yes, what is remaining is aiming, but I think by evening we would have finished aiming. Here we are done. I'm happy that the work has been done and completed as per the scope, and we shall be waiting for our superior leaders to guide us when we should hand over the project. So when I look at such a pitch and I see people running on it, falling, playing, doing all what's necessary, and they go away and they leave the pitch intact, I'm proud of producing such work.
UBC, inspiring Uganda.
Our program of poverty eradication is a must. We want everybody to be involved.
Through the parish development model, Ugandans are starting small but impactful projects to improve their livelihoods.
When we give 1 million, we know it's not enough to do many things, but it's a starting point.
I'm a PDM beneficiary, a farmer. Your Excellency, I was given 1 million Uganda shillings from Kobil Kawo PDM Circle. Your Excellency, I got 20 bunches from my small piece of land sold, got 400,000, put in the PDM farm, Your Excellency, in the PDM money, Your Excellency, I bought a cow of 1,400,000.
In 1 year, 100 families in the parish get. In 5 years, 500 families would have got.
We were the first people to receive money from Nakapiriprit. I received $1 million. I rented 4 acres of land and I was able to harvest 14 bags.
So really this 1 million is enabling somebody to start something. Yes, and we don't want to give too much money to one person because we have got very many people to cover.
The parish development model empowers the people, focusing on lifting up the masses and creating opportunities that ensure prosperity for all. This message is brought to you by the Ministry of ICT and National Guidance.